Anti-obesity drugs. Pharmacologic treatments should be considered for patients with a BMI greater than or equal to 30 kilograms per square meter or for patients with a greater than or equal to 27 kilograms per square meter who have concomitant obesity-related diseases and for whom dietary and physical activity therapy has not been successful. The classification of drugs. Centrally acting anti-obesity drugs. This class of medications affects satiety, feeling of fullness after a meal, hunger, the biologic sensation that prompts eating, and craving, intense desire for a specific food. The biologic effect of these agents on appetite regulation is produced by augmentation of the neurotransmission of 3 monoamines, norepinephrine, serotonin, 5-HT, and dopamine. Phentermine. Sympathomimetic. Phentermine is usually used in combination with topiramate. Lorcaserin. Selective 5-HT2C receptor agonist. Peripherally acting medications. Orlistat is a synthetic hydrogenated derivative of a naturally occurring lipase inhibitor, lipostatin, that is produced by the mold Streptomyces toxytricini. This drug is a potent, slowly reversible inhibitor of pancreatic, gastric, and carboxylester lipases and phospholipase A2, which are required for the hydrolysis of dietary fat into fatty acids and monoacylglycerols. Anti-obesity drugs in development. Bupropion, dopamine and norepinephrine reuptake inhibitor. Naltrexone, opioid receptor antagonist. Liraglutide, glucagon-like peptide 1 receptor agonist. Now, the new approval. Tirzepatide is a GP and GLP-1 agonist recently approved for weight loss treatment. Oral device. Gelesis 100 is a non-systemic, a water-soluble gel that was approved by the FDA in 2019. In the stomach, the capsule releases the cellulose microgel, which absorbs water and forms a matrix with a consistency of food, occupying 25% of the stomach. Surgery. Bariatric surgical procedures. Examples of operative interventions used for surgical manipulation of the gastrointestinal tract. A. Laparoscopic adjustable gastric banding. B. Laparoscopic sleeve gastrectomy. C. The Roux-en-Y gastric bypass. D. Biliopancreatic diversion with duodenal switch. E. Biliopancreatic diversion.